What causes the immune system to attack eyes and TED? Imagine your immune system, which normally protects you from infections, gets a little confused and starts attacking your own body. That's what happens in thyroid disease, also known as TED. It's an autoimmune condition most often linked to Graves' disease, an autoimmune thyroid disorder that causes the thyroid gland to produce too much hormone. But in TED, the immune system doesn't just target the thyroid. It mistakenly attacks tissues around the eyes, leading to inflammation, swelling, and sometimes vision problems. To understand why this happens, we need to look at how autoimmune diseases work. Normally, your immune system can tell the difference between your own cells and foreign invaders like bacteria or viruses. But in autoimmune diseases, this recognition system fails. The immune system starts producing antibodies that target your own tissues. In Graves' disease, these antibodies stimulate the thyroid gland to produce excess hormones. Interestingly, the same antibodies can also affect tissues outside the thyroid because they target specific receptors found in both places. In thyroid eye disease, the main targets are cells called orbital fibroblasts, which are found in the connective tissue behind the eyes. These cells have receptors called thyroid-stimulating hormone receptors and insulin-like growth factor 1 receptors. Autoantibodies in people with TED bind to these receptors, triggering an inflammatory response. This inflammation causes swelling of the tissues around the eyes, leading to symptoms like bulging eyes, eyelid retraction, double vision, and sometimes even vision loss. The immune response involves different types of immune cells. B cells produce the autoantibodies that attack the tissues. T cells, especially a subset called Th17 cells, also play a role by releasing signaling molecules called cytokines. These cytokines promote inflammation and tissue damage. Elevated levels of cytokines such as interleukin-1 beta, interleukin-6, interleukin-8, and tumor necrosis factor alpha have been found in the tears and tissues of people with TED, indicating ongoing inflammation. The process is further complicated by cells called fibrocytes that migrate into the orbital tissue from the blood. These cells can present antigens, which are molecules that trigger immune responses and may help sustain the autoimmune attack. As the inflammation continues, substances like hyaluronan build up, causing the tissues behind the eyes to swell and push the eyes forward. It's important to note that TED often occurs in people with Graves' disease, but it can also happen in those with Hashimoto's thyroiditis or even in people with normal thyroid function. The severity and progression of TED vary widely. Some people experience mild symptoms, while others face significant risks to their vision. While the active inflammatory phase may eventually slow down, some changes like persistent eye protrusion or scarring can be permanent. From a broader perspective, thyroid eye disease is not just a side effect of abnormal thyroid hormone levels. It's a distinct autoimmune process that can develop alongside thyroid dysfunction. Managing thyroid hormone levels is essential for overall health, but treating TED often requires additional therapies aimed at reducing inflammation around the eyes and protecting vision. In summary, TED happens because the immune system gets confused due to shared receptors in the thyroid and orbital tissues. Autoantibodies attack these receptors, leading to inflammation, swelling, and eye symptoms. This process involves immune cells, signaling molecules, and tissue changes that cause the characteristic protrusion and discomfort. Understanding this immune mechanism helps in developing targeted treatments and emphasizes the importance of seeking professional medical care. Always consult healthcare providers for diagnosis and personalized management, as thyroid eye disease can have serious consequences if left untreated.